Welcome to the Birth Squad, the podcast designed to empower birthing individuals with real insights from two Black female physicians. We're here to guide you through your health journey, one episode at a time. I'm Dr. Kamisha Thomas.
And I'm Dr. Ijalma Bello. We are two OBGYNs and longtime best friends, and we're here to help navigate you through the world of reproductive health.
Real women, real stories, real experts, and the facts you need to know.
Tune in every other Sunday, and don't forget to like, follow, and subscribe.
Ready to join the squad? Let's get into it.
We're opening up space for a conversation that's incredibly important, but often left in the shadows: pregnancy loss and birth trauma.
Margaret Towolawi is a woman who has walked through miscarriage and later the loss of her baby at around 5 months of pregnancy. Her story is one of pain, resilience, and healing, and we are honored she's chosen to share it with us.
Now, before we begin, please be advised that this episode discusses miscarriage, loss, and emotional and physical trauma of pregnancy. If these topics are sensitive or triggering for you, we encourage you to listen with care or step away if it's what's best for you right now.
This conversation is raw and real, but it's also about love, strength, and community, because no one should have to walk through this kind of pain alone.
Let's get into it.
Hello, everyone. We are back with the Birth Squad. We are interviewing the amazing Dr. Margaret Towolawi, and we are so excited to have her here today. So let's just get right into it. Dr. Towolawi, do you mind introducing yourself and telling us a little bit about your practice and, who you are?
Thank you all for having me on your platform, and you guys are doing such amazing work. I am a family physician based in the Seattle area. So I take care of families, children, adults, older adults, and I also practice lifestyle medicine. So I look at 6 pillars: nutrition, movement, getting enough sleep, stress reduction, minimizing social substances, and having healthy social connections to prevent, reverse, and treat disease. And I own my own direct primary care practice in Seattle called Nurture Well Center. So that's my day job, but I'm also very passionate about wellness. So I do wellness talks. I teach at different elementary schools. I have 2 published books that I have out, one around nutrition and one around loss that hopefully we'll be able to get into during our conversation.
Amazing. We want to kind of dive right into your journey towards motherhood.
So I knew I wanted to be a mom, and I, being a doctor, tend to be type A. So I was like, I'm going to get through med school. My now husband, then boyfriend, I already knew I wanted to marry him, I think within the first year. We already kind of just knew, but I was like, we're going to have to wait till after I'm done residency. Finished residency in 2013, right? And I was like, I want a year of just being married without any kids. Being a planner, I was like, I want to plan this all out. So top of 2014, I got pregnant and I had a miscarriage around 12 weeks or so. And I remember thinking, okay, having delivered many babies, I don't deliver babies anymore. I knew that miscarriage is, quite common, more common people think. So I was sad about it, don't get me wrong, but I was ready to, try again. So we did that, got pregnant a few months later, and and I ended up losing my daughter at 5 months and 1 day. Turns out that I had to find out the hard way after losing her that I have something called cervical insufficiency, which we'll talk about a little bit more. So that was my second pregnancy that ended in loss. So I had to deliver her, and she passed away little over an hour, 30, 40 minutes after I delivered her. So yeah, and then I went on to have my beautiful children that I have now. A year later, my son was my 3rd pregnancy, and then my daughter. Yeah, so 2 living kids, and then 1 kid that I birthed and lost, and then a miscarriage.
Now let's talk through some of the language you might hear when it comes to pregnancy loss, because sometimes the terminology alone can be confusing and even isolating.
Yes, let's start with the word miscarriage. Clinically, a miscarriage refers to a pregnancy loss before 20 weeks gestation. It's sometimes called a spontaneous abortion in medical terms, which we know can sound jarring or even offensive outside of a clinical setting. But that's the language that you might see in your chart.
There are also different types of miscarriage, and the words can feel cold when you're already processing something emotional. You might hear terms like threatened miscarriage. This is when there's bleeding, but the pregnancy is still ongoing. Missed miscarriage. This is when the baby has stopped growing, but there are no immediate symptoms like bleeding or cramping. And incomplete or complete miscarriage, depending on whether the body has passed all of the pregnancy tissue.
Then there's second trimester loss, which refers to the loss that happens after 13 weeks, but before 20 to 24 weeks, depending on the definition used. This type of loss is less common, but it's often more physically intense and emotionally devastating because the pregnancy has progressed further. And oftentimes, parents at this time already feel deeply connected and bonded.
A loss that happens after 20 weeks is typically referred to as a stillbirth. And again, while those are the clinical definitions, every person's experience is different. Loss is loss, and how it felt doesn't always align with what the textbook says.
In some second trimester losses, one possible cause is something called cervical insufficiency, which is what Margaret had. That's when the cervix starts to open too early, often without pain and without contractions. The cervix is like the gatekeeper to the uterus. It's supposed to stay firm and closed until labor, but if it opens too soon, it can lead to premature delivery or loss, especially if there's no signs or symptoms until it's too late.
It's one of those conditions that often go undetected until after a loss happens. And that's what makes it so hard, because it's silent. And most people don't know they're at risk until they've already been through it.
Exactly. And that's why we're having this conversation, because awareness, language, and understanding are an important part of how we support one another through loss, and hopefully how we can start to change outcomes for others moving forward. Let's get back to Margaret's story.
Thank you for sharing that. Do you mind telling us a little bit more details about kind of what were the circumstances surrounding, that pregnancy loss that you had, your second pregnancy?
So, I had a healthy pregnancy, and I remember it was a Sunday. Okay, I'm going to get ready to go to church. And then I went to the bathroom. There was, blood. And even though sometimes it's hard when you're the doctor and you become the patient, I remember freaking out. And I called my best friend. She's like, you got to go to the hospital, right? Things I normally would know to do, but when you're in the moment, right? So I go to my local ER, and, they put the ultrasound on my belly and everything's looking good, right? And then they're like, okay, we're gonna just check and, do a vaginal exam and take a look. And then the doctor, he, gets a speculum, he used to look and see, your cervix and everything. And he pops up really fast. And I knew what that meant. That meant that something, early opening. I just, I knew. So, and his face just looked the look that I've given people where you're trying to mask the shoot in your head, but you got to be professional. And right, he popped up so fast, and I just knew, right? And he was like, your cervix is opening, and everything he said after that, the details and everything, it all seems like a blur now. But the gist of it was, we got to get you to maternal fetal medicine. There was some urgency, but at the same time, I realized they probably didn't think the baby was viable. So at this point, I have to wait for my husband to come down. And then the plan was for him to drive me to where maternal fetal medicine was at the main hospital in Seattle. And so he drives me to the maternal fetal medicine ward at the main hospital. And, the doctor pretty much tells me we're going to induce labor because this baby's not going to be viable. It was just horrible. There's no other way to see it. All these years later, it still even sucks to even talk about, but this is a very important conversation. In that moment, though, it was a lot of why is this happening to me? I was very healthy, had a healthy pregnancy up until that point, and I was very confused. I remember at one point literally saying out loud to no one in particular in the room, what did I do to deserve this? I remember saying that, and like the nurses in the room, everybody looking at the floor. It was just a very sad and heavy situation all around. Anyway, so they induced me, Pitocin, all the things, and I delivered my baby, my daughter, Grace, and yeah, that was hard. And they had an amazing doctor, Dr. Sarah Waller, who I was going to take it back a little bit. I love how in that moment she knew, we knew this, my baby was going to pass away. She brought this beautiful moment of humanity into the situation where she delivered the baby, and she said, she's beautiful, right? And then she had asked if I wanted to hold the baby. At that moment, I was just and I did not hold her, and I regret that to this day, I'll be honest. My husband held her. My mother, who lives in Los Angeles, happened to be in town because my sister was due to have a baby any second. Luckily, my mother was there and was able to be there for that delivery. So my mom held the baby.
Wow, we are so grateful to Margaret for sharing that. Her story is one that no parent ever imagines having to tell, and yet it reflects a reality that so many silently carry.
And we wanted to pause here and explain a bit more about what happens, medically and emotionally, when a loss like this occurs, especially in the second trimester.
A second trimester loss, typically less common than first trimester loss, but it can be more complex, both physically and emotionally.
Risk factors can include things like cervical insufficiency, when the cervix starts to open too early without pain or warning, infection, placental issues, or underlying health issues. There are also specific risk factors that can lead to cervical shortening, like prior procedures on the cervix, such as a LEEP or a cone biopsy, multiple second trimester losses, carrying twins or higher order multiples, or even just having a history of preterm birth. But in many cases, there's no clear reason, and that can make the grief even harder to navigate.
When someone experiences this kind of loss in the hospital, they are usually admitted and go through a labor and delivery process. That part surprises people. It's not a quick procedure, it's childbirth and it's labor, and it's incredibly emotional.
Something we always emphasize, there is no right or wrong way to process this moment. Some patients choose to hold their babies afterwards, and that is a very personal decision.
From our experience, many families find comfort and peace in getting to hold their baby, to see their features, give them a name, say hello and goodbye all at the same time. It's sacred, even in the sorrow. Now let's get back to Margaret. I mean, I'm so sorry to hear that happened to you, right? That's a difficult situation. I think I can speak for Ijama in saying it's one of the most difficult things that we do in our profession. And figuring out how to help people process that when we are all feeling like the heavy weight of those emotions is an art. And it sounds like you had an amazing provider kind of help you through that. How were you able to process that? How did you navigate that period afterwards?
I mean, it seems like a blur when I look back. As Black women, we keep going. I think the biggest thing for me was I had to take control of the situation. I knew that, I had to communicate to people. Like my friends, they all thought I was pregnant still. So I remember, I can't remember if it was 2 days later, but I remember distinctly typing out an email to my closest friends, letting them know that I lost this baby. Looking back, I'm like, that's kind of crazy. Like I should have just let it sit for a bit, maybe called people or had my husband call, but I remember drafting up an email just so I wouldn't get any random, how are you feeling? How's pregnancy going? Just to have some control, right? Now, I also remember, I regret looking back taking, I had a baby. I wish I had taken some maternity leave, honestly. I think I took no more than 2 weeks off from work. And I remember thinking, I got to go back to work and show them that I'm okay. And this sounds so odd, but not odd in light of being a Black woman and trying to, make sure people know you're still okay in mainly white settings. I remember thinking, I'm gonna go to work, I'm gonna make sure I look fly, and I remember going back to my clinic and my MA saying to me, I just knew you're gonna come back looking good, doctor. Because I just, I didn't want to look like what I've been through, and I feel like a lot of that is ingrained culturally into us as Black folks, Black women, and then even me being Nigerian, like we got to keep going, I'm Igbo. My parents both lived through the Biafra War. So it's just keep going. But I had wished I allowed myself more time to sit and grieve, take more time from work, right? And I have an amazing family and friends. And at the time, though, the thing that I sat with and struggled with the most was feeling like I had done something wrong for this to happen. So there was a point when I did seek out, because no matter how many people I talked to, no matter how supportive my husband is and was at the time, no matter, my best friend, all the things, I have great friends. I still had this lot of guilt that I couldn't get around, so I sought out a grief counselor, but she was amazing. She really helped me get over the mental block that I had done something wrong to lose my baby. For me, there was some mental work that she helped me sort through to release the blame of having done something wrong that made my baby made my cervix open, and then made my baby come too early. That led to her untimely passing, right? And then, it was hard because in Washington State, if the baby's over 20 weeks, you got to bury them, right? So it's like navigating my sister. She eventually had her baby like 5 days later, right? And then so my family's like celebrating my sister having her daughter. I just lost a daughter, literally, at the cemetery, securing a plot with my husband, and then leaving the cemetery and getting a text from my mom that my sister just had her baby. It was just a lot. It was a lot. It was a lot of emotions, roller coasters during that time. But
When someone experiences pregnancy loss, especially in the second trimester or later, it can feel like the whole world just keeps moving while you're stuck in the middle of something that no one else sees.
And that's why it's so important to take grief head on. Not to rush through it, not to pretend it didn't happen, but to actually sit with it, to name it, to let it be real.
Grief after pregnancy loss is complex. It's the grief of losing a future you were planning for, a name you may have picked out, a baby you may have felt kick. That grief deserves space.
We've heard from so many women who say the hardest part wasn't just the loss itself, but what happened afterwards, the silence, the in between of not being able to be recognized as a mother, people around them not knowing what to say or saying nothing at all.
But here's what we want everyone listening to understand. That pregnancy was real. That baby mattered, and the love that grew in that short time, it was real, and it made them a mother.
So if you're supporting someone through pregnancy loss, start by just recognizing their experience. You don't need the perfect words, you just need to show up. You can say things like, "I'm sorry, I'm here to listen. You are a mother, and your baby is remembered."
And remember, don't rush their healing. Don't try to make sense of their loss, just acknowledge it. Bring meals, send a card, say the baby's name if they've shared it, ask how they're doing, really doing.
And if you are grieving, please know you are not alone. There are support groups, therapists, and people who get it. You deserve the time and the space to heal. You are still a mother. We've provided some resources in the show notes for you to refer to.
This is your story. This is your motherhood, and it matters.
Margaret, I know you've processed this and you really overcome this, challenging part in your life, but as an OBGYN hearing this, it's so heartbreaking, especially as you're describing that part about after, because really what we see is, you leave the hospital. But yes, there is that part about having to find a plot, having to actually, bury the baby. So just, my heart goes out to you and to other women who experience this. And just what a journey that you went through, and then the resilience that you showed to work through it, and then ultimately to move forward with your next, right? So how did you navigate that? Yeah.
It's the part that's hard, right? Because you still gotta, I still want to have other kids, right? And that's why I wrote the book, which we'll talk about later. But and when you have a loss like that, you guys know they say wait a year, right? And Dr. Sarah Waller, I'm going to keep saying her name in case someone listens to this and they're in Seattle, so they can connect with her if they have something like this happen to them. Sarah Waller, she was so great in that. So seeing her at my postpartum visit, and she looked at me straight. She said, "Look, I know they say, we recommend a year." She said, "I know you want to have a baby so badly." She's like, "Just wait 3 months." She said, "You can at least wait 3 months." So that's what we did, and 3 months later, I got pregnant with my son. And that was a whole nother journey in and of itself, because now that I had the diagnosis of cervical incompetency, my cervix opens too early, there were things that we had to talk about, right? And it was the cerclage. So with him and my daughter I had after him, at around 12 weeks, 13 weeks, 12 weeks, my cervix gets sewn shut, which is not fun.
So let's talk about something that comes up after a second trimester loss, especially when cervical insufficiency is suspected: a cerclage.
Yes, a cerclage is a procedure where the cervix is literally sewn closed to keep it from opening too soon during pregnancy. Picture the cervix like a drawstring pouch. When everything's working right, it stays tightly closed until it's time for labor. But if the cervix starts to open too early, a cerclage acts like a stitch that cinches it closed and helps keep the pregnancy safe and supported.
Most commonly, we place a transvaginal cerclage, which is done through the vagina, usually between 12 to 14 weeks of pregnancy. In some special cases, like when a transvaginal cerclage isn't possible or didn't work in the past, a transabdominal cerclage may be recommended instead. That's placed through a small abdominal incision and is typically more permanent.
So the question comes, who actually qualifies for a cerclage? It's typically considered for people with a history of second trimester loss or very early preterm births, especially if those happened without labor pain or contractions. The pattern suggests that the cervix may have started opening silently. Again, something we call cervical insufficiency.
It can also be recommended during pregnancy if your care team notices your cervix is shortening too early on ultrasound. This is usually before 24 weeks. That's called a rescue or an ultrasound indicated cerclage.
And here's something really important. The decision to place a cerclage should always be guided by a maternal fetal medicine specialist, or MFM. They'll look at your history, your current pregnancy, and help you weigh the benefits and the risks specific to your situation.
It's not a decision to take lightly, but for many patients, a cerclage can be a powerful tool to help support a pregnancy and protect hope after loss.
So if your provider mentions a cerclage, take a breath, ask questions, and know this. It's not about fixing your body. It's about giving your cervix the support it needs to help carry your baby safely.
And as always, you don't have to figure it out alone. There's a care team, there are options, and there's always space for hope. Now let's listen to how Margaret's next two pregnancies went and how she ultimately used her grief to create a beautiful story.
At 20 weeks, I remember going to the OB. Dr. Waller was not there that day. I saw a different doctor. And, they had been watching me getting ultrasounds. And At 20 weeks, something looked like the cervix was starting to shorten, which was concerning. And I'm thinking in my head, golly, they already told me the cerclage was not a guarantee, but it's helpful. And at this point, though, like I'd already lost the baby. So I was like, okay, what else can you throw at me? At that moment, I was a patient. So I was like, and I'm already like, I'm thinking we're back where we were because it's 20 weeks again, right? 20 weeks, right? And she was like, oh, bed rest. Yeah. And I remember her saying, don't expect any miracles. And it sounds cold the way I'm saying it, but she was just trying to be very matter of fact and whatever in the moment. She's like, don't expect any miracles. My cervix was shortening. The next appointment was going to be in 4 weeks when the baby would be viable. At this point, I felt like I was sitting and waiting and cooking and seeing if I get 24 weeks. So 24 weeks comes, my husband takes me to get ultrasound. And at this point, my regular doctor, Dr. Waters, there that day. She's taking forever to come in the room. I kind of know how long it should take after, having done this before. And she walks in and she opens the door and she says, I kid you not, she walks in and she says, it's a miracle. And this makes no sense to you guys. It doesn't to most people. Somehow my cervix, it sounds crazy, but it stopped shortening and it lengthened somehow. It's a miracle, So then I was like, okay, God, we're going to be all right. So many things that happened in that pregnancy that God definitely had me covered. And Dr. Waller walks in, she's like, it's a miracle. And at this point, we're kind of proceeding as normal. Still on bed rest at home though, and I'm going to the OBs. I think it was every 2 weeks, getting ultrasound. I was able to hang tight in there till around, I delivered him I think I got induced at 37 or 38 weeks. I took the cerclage out probably at 36 weeks or so. But anyway, but yeah. But he came, I delivered him. And he was, my 7-pound, 13-ounce kiddo. But it was great to leave the hospital with the baby. I'll tell you that. I can tell you that. It was a really amazing, amazing thing to go home with the baby. That felt good. And then with Shai, she's now 6. That was a great pregnancy. I had the cerclage, same old, no bleeding. I was able to work the whole time. So I was like, yeah, finally I had a normal pregnancy in that regard, right? It had this amazing doula, black doula. I'm gonna have this baby without payment. So I did all that. Yay, it was great. And then I delivered her 9 pounds, 13 ounces at 41 weeks, I think it was. They induced me because she was getting big, right? But yeah, so all kinds of excitement around having babies. So having babies is not for the weak, I tell you. But those are my birth stories.
Wow.
And yeah,
Yeah, you are a warrior because nothing went according to plan, right?
there was always a curveball.
But we're so happy to hear that you were able to have 2 full-term children, right? And that's
Hmm.
our hope, with women with cervical insufficiency is that the cerclage will allow them to have what you have. And
Yeah.
it's unfortunate that multiple people have experienced that. And so sometimes there are risk factors, but for a lot of women, we just don't know until it happens, unfortunately. So I want to kind of shift and ask you to kind of tell us a little bit about your book, right? What inspired you to share your story?
You. So the specific book, I am an AIDS train ride to Graceland. So after I had Grace, of course there was this void, she's buried in the cemetery on the main road near my house. So I pass by the cemetery every day. After I had her, I thought the feeling of losing her would get better. And I thought that maybe having my child after her, my rainbow baby, things would feel a little different. Did in some ways, but the pain was still there. So I'm very proactive. So even before I had my son after her, I reached out to Dr. Waller. I was like, there are other women who go, something similar. And she put me in touch with another woman. And then we had formed a group, Racist Circle, Grief Resource. It was around infant loss and it all fit with her name. And it was great. And it was about 3 or 4 of us would meet at different coffee shops and just talk about how we were doing. And the purpose behind the group was for women who had some type of loss, stillbirth, early infant loss, miscarriage, and they were still hopeful for a child after having that loss. So we did that for a bit, and then people went on to have their kids. And then I remember making a little garden in my backyard. It was nice for a season, but I was like, how can I, have put something out in the world? And I realized issue I had was I felt like aside from my husband and I and friends, no one, I wanted the world to know my daughter, if that makes sense. And I've always enjoyed writing. I was like, I want to write a book that honors her somehow. Specifically, the target audience would be people who have had a loss and then had other children and want to find a way to start the conversation around that loss and the baby that they lost with their children. So I was like, I'm going to write a book about it. So And my son, I am, he's the main character. The setup is he has a dream and he loves trains. He has a dream and then he meets his sister in his dream in Graceland. And in this scene in the book, he's meeting her and she's thanking him for helping his family, our family, get through the loss of losing her, and filling that void. It's a really beautiful book, and I'm biased because I wrote it, but it's a very personal book. But the people who know about who gotten the book and purchased the book, they're always touched by it. And I want to do this podcast, being honest with you guys, but this book is still very hard for me to talk about because again, Grace, she would have been 10. It's 10 years later, it's still very hard. But I know this book is so important. So when I came across you guys online, I was like, I want to tell my story, share this book with the world, so people know about it. It's a resource for you if you've had infant loss, if you want to have more kids, if you have kids already, want to discuss the topic, this book is a resource for you. So yeah.
Thank you so much. Honestly, I feel like your story and this book that you've written can really help women who have gone through this and also help those who know someone who's gone through this, because it's like oftentimes you don't know what to do, you don't know what to say, but what a wonderful, beautiful story that you created, for people who are going through this.
Yeah. I had a patient come to my office, my gosh, and she had the book on the bookshelf. And the patient goes, "Oh my gosh, I just saw that book at my friend's baby shower. I was helping my friend clean up after the baby shower. And she says, so and so, I got to show you this book someone gave me." And so my patient grabbed the book at her friend's house. And then she says, "That's my doctor." So it's out there in the world, it's on Amazon and it's on my website. But it just touched my heart that it's still finding people. And that just makes me so happy for that reason. Like,
It's beautiful. And that's, my next question. This book is a wonderful resource. But in addition to that, as being an option, how can, loved ones and friends, like in your opinion, best support someone who's, gone through or recently is going through a pregnancy loss?
the first thing you don't want to say is, "You're young, you can have another baby." And all that may be true at the time. Just think it in your head. Do not say that out aloud, okay? Also, don't say, "You are so healthy. How did this happen to you?" Don't say those things. I'm going to tell you these things that were said to me by people who meant well, but that was not, I did not want to hear that. So for just coming out the gate, I'll say that. But other things you can do, give them resources, give them books, sit with them. What can I do to help you? I had people just come sit with me. People, not that I needed things, but like people sending me encouraging books around loss. I have a friend of mine from residency. She sent me like this guardian angel ceramic little thing. It's still on my nightstand. To this day, if I see it, it just gives me comfort. So just something, it doesn't be anything of extreme value, but just to show you that you're there, because some people, they may not want to talk. So give people space, but then circle back, that's fine too. If you know the person, they may need a meal train, or dropping off some food, because self-care can fall apart for some people.
Great pieces of advice. I couldn't agree with you more. It is sometimes really hard to know what to say. And I think just holding space is huge and just being there. And I think another piece is asking them, how can I help you? Right? Instead of trying to put your expectations of what you want on that person, just asking them, is there anything I can do to support you? Or I'm here for you. I think those are all really great things. I wanted to ask you, is there anything else that you would like to share with our listeners?
I know some of this conversation can be very triggering for people. So afterwards, take a moment, hold some space for yourself. I'm praying for you. I'm thinking of you. If you've had a loss and it's still very fresh, my heart is with you. I've been there. Okay. And I thank you guys for this platform. And I also want to say, please don't isolate yourself. There are like-minded people. And once you start talking about it, that's why we're having this discussion. Once you start talking about it, people come out the woodworks and you'll find out people, oh, I had that happen to me. I had a friend, or that happened to my best friend. And once I got in community with other women and I built that community, the stories were so encouraging, because in the moment you can feel like you're so alone and no one else is going through what you're going through. But there are many people who've had this, many other women of color too. So finding community online, this is a great resource to get the conversation going. And as far as connecting with me, I'm on social media. I got a few platforms, but I think the main one to start around would be on Facebook, just my name, Margaret Towolawi, MD. Same on LinkedIn. And if you want to purchase the book, it would be margarettowolawimd.com, where you can get the book. And if you are a doula or a birth worker or anyone who wants to buy the book in bulk, that is always an option as well. Yeah. And then as far as if you're in the Seattle area, I have my primary care practice is nurturewellcenter.com. And then I do have a related holistic skin business called SkinStatMD.
Well, thank you so much, Dr. Towolawi, for being with us. Thank you for sharing your story, your vulnerability, all of your insights, and especially that book. So it is going to be on my list of a great resource to, give people who are going through this time. So thank you for being here.
So that's it for today's episode. If you take one thing with you, let it be this. Grief deserves space, and honoring pregnancy loss starts with simply acknowledging that it happened and that it matters.
A huge thank you to our guest, Dr. Margaret Towolawi, for bravely sharing her story. Healing begins when we talk about the hard things and when we let people feel seen in their experience.
To learn more about Dr. Towolawi, we have all the links and contact information in the show notes.
Thanks for listening, Birth Squad. Be gentle with yourself, be kind with others, and we'll see you next time.
That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts of your experience, and we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad, and check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Ogwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from The Birth Squad.